Hi, this is Dr. Abhilash T, Consultant Neurologist, Wellness Champion Hospitals. Most of us would have experienced at least one episode of headache in the past 1 year because it is one of the commonest neurological symptoms that will affect everyone in some point in our life. It is one of the commonest reasons for individuals visiting neurological OPD or even the casualties. It is estimated that around half to three-fourths of the old population is affected by headache. So the reason for headache can be as simple as stress or as big as a stroke. It can be as simple as common cold to as big as a cancer. So it needs to be evaluated. The headaches are primarily and broadly classified into two types. There are primary headaches and secondary headaches. Primary headaches includes migraines, tension type headaches, trigeminal autonomic cephalalgias. And the secondary headaches, these are the proper headaches that are due to any other secondary cause, say infection, stroke, tumor in the brain, any thrombosis or any other secondary cause that is leading to the headache. These are called secondary headaches. So coming to the primary headaches, commonly we encounter what we call migraine. When we ask people surrounding us, they'll tell that they are also affected by migraine because it is as common as 1 in every 2 people are affected by migraine on various levels of severities. So what causes migraine? In simple terms, it is basically hormonal imbalance in the brain. We call it trigeminal-vascular hypersensitivity. It is due to the hypersensitivity at the level of free nerve endings of trigeminal nerve that releases some hormones that causes this type of headache. So it is particularly more common in women than in men and affecting people that aging between 20 to 50 years commonly. We can also see patients younger than 20 and older than 50 with migraines. This type of migraines starts at around 20 years of age and ranges till 50 years. These headaches are the patient frequently complains of one-sided headaches during one time that shifts to the other side in the next episode. That is, we call it alternating headaches. So he might present with complaints of left-sided headache today, and after 1 week he'll tell that my headache is on the right. That is associated with nausea, feeling of vomiting or even vomiting. They'll also tell that they are sensitive to sound and light. So when they hear loud sounds or see bright lights, the headache will get aggravated. So there are some aggravating factors for this type of headache, like hunger, sleep deprivation or sleeplessness, in particular stress and certain foods, bright lights, loud sounds, and some strong smells. We call it osmophobia. These all can trigger the migraine type of headaches. So these headaches can also be associated with some feeling what we call aura. That is, this aura can be in the form of visual aura, sensory aura, auditory or abdominal aura. So there are various types of migraine depending on what type of aura the patient is having, what type of headache he is having. And the headache of migraine typically lasts for around 4 to 72 hours. That is anywhere between 4 hours to up to 3 days it can last. Beyond that 72 hours, if the headache is still there, we call it status migrainosus, which requires admission and treatment with intravenous drug. So the treatment of migraine. Coming to the treatment of migraine, the first is changing the lifestyle. Some lifestyle changes are required to avoid the episodes of migraine and to avoid the aggravating factors. The aggravating factors we have already discussed, like bright lights, loud sounds, hunger, sleeplessness, stress management, and also there are certain foods which we need to avoid. Some foods like cheese, chocolates, peanuts, cashew nuts, red wine, and Chinese foods containing MSG. These foods can trigger the migraine attacks and it can get aggravated. So coming to pharmacological treatment, there are various groups of drugs that we use to treat the migraine. The treatment of migraine is basically treatment of acute episodes of migraine and prophylactic treatment. Acute episodes they can be as simple as the over-the-counter analgesics to treat the headache or some advanced drugs what we use to treat the migraine. So the acute episodes are commonly treated with over-the-counter analgesics. Prophylactic treatment is what we call preventive treatment. And the patient is experiencing more than 2 episodes of disabling headache in a month, so he requires prophylactic treatment, and there are various groups of drugs what we use. Even there are advanced treatments like Botox injections, monoclonal antibodies we use to treat migraine as a preventive therapy. But it is also advised that the patients maintain a headache diary, which tells the number of episodes they are having in a month, the severity of episodes, the duration of episodes, and the aggravating factors, leading factors, and the associated features during the headache. So it would be ideal to maintain a headache diary to monitor the treatment response as well. There is something called the red flags or warning signs for headaches. Some patients might be experiencing headache for the first time, but how do they know when to visit the doctor's clinic or when to take the over-the-counter drugs and stay at home? So there are some signs called red flags. So these red flags are, so when the patient complains that his headache has started just now and within 1 minute it reached its peak intensity, that is called thunderclap headache. This is a warning sign. Second one being associated neurological deficits like any vision problems, weakness of one-sided limbs, weakness of the face that is associated with this. This is also a warning sign or a red flag symptom. Associated features like fever, neck pain, seizures. These are also warning signs for a headache. And new onset headache or change in character of an already existing headache. Suppose the patient is having one particular pattern of headache in his life and he noticed the pattern has changed since the last episode and the severity has increased. It is also a red flag. These are the times when the patient needs to visit a doctor clinic on emergency basis and get evaluated. So the basic investigation what we do is an MRI scan. MRI scan is to rule out the secondary causes of headache or the secondary causes of the migraine. But in migraine, the MRI scan is most of the times normal. For any headache related queries, consult a neurologist at the earliest possible time and get evaluated. Let us take up some questions or queries and I'll try to answer them. You can comment below the questions and I'll answer. MRI in migraine, we have already discussed. MRI in migraine can be normal most of the times. It will be normal most of the times. Sometimes there can be very minute changes, but most of the times we do a scan in migraine to rule out the secondary causes, like some stroke or some infections or some bleed inside the brain or some hemorrhages. To rule out this, we do a scan in migraine. How is the pain rating in migraine? The pain, the severity of the pain, if you are asking, it is moderate to severe. Most of the people find it disabling and they feel that they can't work properly or they can't be productive at their work because of the headache. So the headache is moderate to severe intensity most of the times. Differences between regular headaches and migraines. There is nothing called a normal regular headache. There are few categories of headache where it will fall into. So if you are taking the normal stress-induced headache or migraine, if you are comparing, so migraine has some particular characteristics like unilateral throbbing type of pain with nausea, vomiting, photophobia and phonophobia. So this type of headache is characteristic of migraine. Next, can it be hereditary? Yes, there are some variants of migraine which can be hereditary. That is, they can run in families. There are particular genes which causes this type of migraine in families. It can be inherited. What are the lifestyle changes required? Okay. The lifestyle changes are the main stepping stone for treatment of migraine. So the first thing what we advise is to try lifestyle changes. That is reducing the stress, reducing smoking, reducing the alcohol consumption, eating on time, sleeping on time, and avoid the foods that I have already told that aggravates migraine. You have to avoid those particular type of foods. Thank you.